Welcome back to my channel. Today I have a special guest with me, and that is my husband, another dermatologist.
Hey guys, how are you?
This is Dr. Anand Haryani, board certified dermatologist. So I figured he could join me in the conversation because today we're going to be talking about acne scars, prevention, treatment, and everything in between.
Acne is one of the most important topics to discuss because so many people, if not everyone, has somehow had an issue with acne, has had a pimple, or has suffered from severe acne throughout their life.
There's lots of myths out there, so first we're going to do all the myth busting and then we'll go into all the facts. Does toothpaste solve acne?
That's an interesting one, I guess. I've never really heard that, but actually we've had a lot of people asking that. So it might take an old wives' tale or something from previous generations. There was actually you're the one that taught me this.
There used to be an ingredient in toothpaste, which is now no longer in toothpaste. I think it got banned or something along those lines quite some time ago. But that ingredient would help acne back in the day. So I think that, when people used it, they saw a little minor maybe relief and some better, resolving acne.
Sure.
But now, since we don't have that ingredient, we really shouldn't be putting toothpaste on our face. Now it's just weird.
Yeah.
We need to put that on our teeth and that's it.
Yeah.
Okay, so that's a myth. Do not put toothpaste to help your pimple.
The biggest one that I've heard is that popping the pimple helps it go away faster. That one's tricky because I always see this more in adults, and I think what happens is when they're younger, they did pop one and it possibly went away a little bit faster, and it just sort of reiterated this bad habit of I should continue popping.
Well, truth be told, when you pop a pimple, you release the bacteria, and once it's expressed out, that does sometimes allow for the lesion to heal. However, there's two things that happen when you do that. Number one is you're picking and digging, so that pressure and trauma from your nails, from your fingers, is actually going to further cause scarring issues. So like whether it's hyperpigmentation, if you're prone to getting darker spots, or whether it's like severe scarring, because sometimes you can like really dig in there. And then secondly, you sometimes when you're putting that pressure to get the comedone or the pustule to express outwards, the bacteria and pus sometimes goes inwards too, because you can imagine that pressure has to go somewhere. So when you're pushing it laterally, it's either going to go up or it's going to go down. And sometimes it does go down and it goes deeper, and that causes a more severe pustule down the line. So definitely don't pick at it. Yes, in one hand, it will release that bacteria out, but when it's done under non-sterile conditions with your hands that have lots of bacteria on them, and secondly, when it's done with a non-expert, I just don't think it's a good idea.
There probably is a time where a pimple has to be popped just because it's gotten so
like a deeper cyst.
Yeah, or maybe even something that it's so superficial actually that that content is ready to come out, and there's probably a right way to do it, but it's definitely not leaning over your mirror at home with dirty fingers and then just squeezing away.
Yeah.
I was guilty of thinking this for 15 years. So I would swear that if I ate tomatoes, I would get a breakout. Or if I had chocolate, for sure the next day. Even I just had a lot of salsa and I feel like I broke out. And in the back of my mind, even though I know better, I still think that maybe it's related. But anyways, tell me what the truth is.
All right, Dr. Haryani.
I know.
So the truth is really, most foods generally are not going to cause a breakout. Now, the reason I say most is because there is some studies that have data showing that certain items like fat-free dairy milk or any sort of dairy can actually lead to increased pustules, papules, and acne in general. And now, I just want to say that it's more a correlation than a causation. So we really need to know the difference. Correlation is, they've done studies, they've shown that people that ate more contents of fat-free dairy had more severe or more lesion counts of acne. That's a correlation. That doesn't say that necessarily that dairy item made them have acne. So
it's two independent things are happening and you're not really sure if one is causing the other, but they just happen to be happening at the same time.
Right.
Okay.
So if you're going to choose dairy items, for whatever reason, then maybe opt for whole milk or whole kind of.
So avoid like the skim.
Yeah, avoid
Okay.
skim, avoid non-fat, because they've just shown that the male hormone is more present when they filter and do all the things that they do with milk, which I don't know the process, but I do know that the theory is that more of the male hormone is left behind, and that's what ultimately possibly leads to acne. There are studies also showing that high glycemic index foods lead to acne. So what are high glycemic index foods? Really foods that basically increase your blood sugar levels and do it very quickly. So things that are fatty and high sugar content. So when you offer cleaner, healthy eating, generally that's a low glycemic index. High glycemic is, all the junk food that's really out there. Now, again, that's a correlation. Does not mean that you go eat salsa or chips if you're gonna get an acne spot. But if you continuously do notice that, I am eating like all these sugary items and I am getting more acne counts, then maybe try to decrease that and see if it makes a difference. Overall, I would say, the myth about food causing acne, it is false overall, but with those two caveats that I talked about. Oh, and I also want to mention whey protein. Whey protein has also been shown to be correlated with increased acne counts. Acne is multifactorial. There's many different reasons for it, from genetics to the environment, and we're going to dig into all of those. But let's talk a little bit about what is a pimple. So, what is a pimple?
Pimple is really an inflammatory, it's actually the result of an inflammatory cascade. So you end up getting white blood cells, you end up getting immune complexes from the body that are trying to fight off this bacterial overgrowth that's happened. And we'll kind of get into how it happens in a few minutes. But the idea is the body trying to get rid of it or fight it off. And when it does that, it creates this sort of wall of inflammation, and then we end up with a pimple. And there's different types of pimples for sure. I'm sure many of you know that there's whiteheads, blackheads, you get the really cystic ones that feel like they're really painful. So different degrees for sure, but I think the pathophysiology, which is basically the cause of it, is similar in root to all of them.
We're going to get into the three different types. So mild, moderate, severe. So those are the categories, and in mild you have open comedones and closed comedones. Those are your whiteheads and blackheads. And then you also have a few pustules and papules. And then when you transfer on, you have moderate acne and gets to be a little bit more severe. So you have more pustules, more pimples, more comedones. You kind of see it diffusely on your face, sometimes in your chest and back area too. And then you get into the severe type, which can cause severe scarring as well once it heals. So with severe acne, you're going to see cysts that are deep-rooted. You're going to see lots of other pimples, pustules, and papules, and then also the comedones that we talked about, the whiteheads and blackheads.
A couple important things to differentiate those, because some patients will ask, how do I know whether I'm mild, moderate, or severe? So absolutely, it's going to be lesion count. So how many of each of those inflammatory bumps do you have, whether you have a lot or a little, really. And then on top of that, you're looking at the amount of inflammation. So you can have a lot of comedones, which are the whiteheads, like we talked about, and you're still in the mild category because you really don't have that much inflammation. And oftentimes you don't even see those bumps, you really just feel them kind of with your finger when you're washing your face. You'll feel like, oh, this doesn't feel smooth. And that's sort of your very earliest type of acne, and a lot of people have that. I think the other thing, that's sort of a misnomer is, like we were saying, the cysts that come with acne, they're not really true cysts. So when someone says they have cysts from acne, really it's just the amount of inflammation there has created a ball underneath the skin. It feels like a cyst, but truly it's not a cyst, because a cyst is kind of in a different category of a growth in general. So that word nodulous cystic acne really is kind of a misnomer, but I think we use it to get across clinically what's going on, and so patients feel like they're understanding what we're saying as well.
Alright, so now let's get into all the different factors that actually cause acne, because I'm sure you guys are interested. We kind of hit on some of them. So first off, we have things like environmental factors. So that's pollution, hormones, stress. those are more indirect things.
People talk about hormones playing a big factor. It's probably important to understand why that's the case. You know, when you're in your adolescence, when you have the most acne, or I should say when you have the most likelihood of having acne, in your young teens, it's because your hormones are increasing at that point. So hormones and even cortisol from stress, because eventually that does actually lead to increased hormones as well, that actually causes increased oil production. So the hormones act on the sebaceous glands, which are the glands that produce oil. They produce oil, and so now you have slightly more oily skin. Skin cells, or keratinocytes, they start to stick together. So generally speaking, healthy keratinocytes sit next to each other. They don't clump as much, they don't aggregate. So what happens is they end up aggregating a little bit too much, kind of becoming sticky. When they become sticky, they're not as easily turning over, and so you're getting now clogged pores, right? Because your skin cells should be turning over layer by layer, but when they're not able to do that because they're stuck together, you now have a clogged pore. That clogged pore becomes like a perfect breeding ground for bacteria. The bacteria name was
P. acnes.
P. acnes, okay, that's pretty easy to remember. So P. acnes, so that actually starts to aggregate in those clogged areas, and then you have the body that sends its cells and its inflammatory molecules, I guess, to fight that off.
Macrophages, all these funny names that, you know, are basically different inflammatory factors in your body that come and try to now attack this bacteria level and cause more inflammation in the area. And sometimes inflammation is really the reason that you see the redness, the increased volume that's going on there. So if it's a larger lesion, that's like swelling. So swelling and redness are a result of inflammation.
Yeah, and I think even though there is a bacteria that's involved in the process, when I explain it to patients, I'm not saying that they have a bacterial infection, right? The bacteria is just part of the process of what happens, and I think everyone has a bacteria on their skin.
They do, to a certain degree. You know, a lot of people have this P. acnes bacteria on their skin, and it's fairly normal to have it, and it doesn't always mean it's going to cause a comedone, a pustule, a pimple.
Right, yeah, that's true.
So it's really the inflammation that ends up causing these more severe types of acne lesions. And, you know, there's many reasons for that inflammation to occur, even like we were saying with hormones, because the hormones produce more oil. The oil allows, it's all a process. The oil then allows for the acne, P. acnes bacteria to gather, and more inflammation then comes, and then the whole thing is a big cycle. Let's get into the next thing. You know, stress we talked about as well plays into this whole thing, and anytime you have inflammation in your body, you have stress causing inflammation, that's going to come out in different areas too. And now we know with modern science how important inflammation is and how to control that, and how it, you know, impacts every level and every type of disease, including diabetes and heart disease and all of that. So keeping stress level down is super important.
Easier said than done, but super important.
Medications can cause acne as well. So, you know, you want to really discuss with your dermatologist if there's certain medications that you may be taking that are actually causing acne, because that is one of the side effects, quote unquote, for some medications like lithium, for example. But, you know, again, this is something you really need to discuss with your physician, because it depends on each person, what medications they're taking, how they're interacting in their body, and all the risk benefits of that.
I think another really important one is genetics. Not to say that, you know, a parent that has clear skin can't have a kid with acne, because there's those many other factors that we just talked about. But we definitely see in clinic when kids come in, they have really bad acne, and we ask the parents, you know, did one of you guys have acne when you were younger? Generally speaking, I think the answer is yes. If someone has severe enough acne, I think it generally is coming from the genetics, and there's some predisposition in that pathway.
Yeah.
But I know that there's some other big factors too that you wanted to discuss, or some syndromes actually associated with acne.
Yeah, so, you know, again, something to discuss with your physician. First of all, you know, you really need to have a full evaluation with a board-certified dermatologist, because there's so many syndromes that can occur that can also cause acne, but acne is just one part of the whole spectrum. For example, one that comes to mind that a lot of women have dealt with and asked me about commonly is PCOS, polycystic ovarian syndrome. So this is a syndrome that actually has many different aspects to it. So one is acne, and the other parts of it have to do with hormonal imbalance, your LH-FSH ratio, and you can have increased hair after places like your chin, and then decreased hair sometimes on your scalp area. So my point is that with a full evaluation with the dermatologist, you can actually pin down if your acne is just run-of-the-mill, or maybe it is part of a larger syndrome. So it's just important to get it evaluated.
Causes of acne are different among different people, and understanding what the cause is directly going to impact how you treat. There's a few things that probably everyone can do.
Yeah.
So maybe we can start with what a few of the basic things are.
Yeah, I mean, there's sometimes decreased access to care. So if you're not able to get into a dermatologist like tomorrow, then things that you can try in the meantime, and this is not meant to replace medical advice, but generally speaking, there's many over-the-counter treatments these days for acne. So generally, you can start with topical retinoids or benzoyl peroxide is our kind of go-to first-line treatment. So when you have milder acne, retinoids tend to help really nicely because they help to exfoliate and kind of do that skin cell turnover that helps get rid of the top skin cells that may be clogging and causing some of that inflammation.
Got it.
And then benzoyl peroxide is also bactericidal, so that's wonderful because you can actually cause the bacteria to slow down and die off from the benzoyl peroxide. And there's like 5%, 10%, and these are over the counter.
Okay, perfect. So the two over-the-counter things you'd recommend would be a benzoyl peroxide, wash or topical?
They come in both forms, so you can, if you feel like you're getting really dry from having a topical treatment like a cream overnight, then maybe try to switch it off with a wash because that's on your skin for a little bit and then it's washed off, so it's not as long-lasting an effect. Retinoids are used at nighttime. Again, if you're breastfeeding or pregnant, I do not recommend using a retinoid, so that's number one. One that I can think of over the counter is called Differin. So that is an adapalene, it's a third generation retinoid, and it's great because it's lipophilic, so that means it targets the oil glands and it gets down and affects it at that level where the bacteria is growing.
And that's big because that actually only recently came over the counter. I think previous to that, in order to get a true retinoid, you had to get a prescription. So that's a big step for young patients that want to at least get started on something until they go and see a dermatologist. The other thing that's really helping is when we talked about what's causing it, I think it's always good to connect it back to what causes it. So we have the benzoyl peroxide that's treating the inflammation and the acne, and then you have the retinoids that are sort of breaking apart those skin cells that are getting stuck together. So by breaking them apart and causing that turnover, the pore doesn't get clogged. So I think that's a big reason of why it works and why it's kind of the gold standard, really.
Yeah. Another one I do want to mention too is salicylic acid and other acids, beta hydroxy and alpha hydroxy acids. Those are great because they actually can also do skin cell turnover. Salicylic acid particularly has been known to be very, very beneficial when it comes to treating acne because again, it kind of gets down to the oil gland level, so it's decreasing inflammation and helping skin cell turnover.
Yeah.
And then, again, going back to going to your dermatologist, you can get treatments with antibiotics in them. So clindamycin is a really good one that a lot of derms prescribe.
So I use clindamycin a lot. I think that's a topical and it works well. Really when I talk to patients, I tell them that it's working as an anti-inflammatory. Again, all of their antibiotics, so you think that they're killing bacteria. Yes, they're working on bacteria, but again, the real issue with acne is inflammation. So we need to use certain antibiotics, because not every antibiotic will do this, certain antibiotics to really bring down that inflammation. So clindamycin I like a lot.
And then sometimes they combine clindamycin with benzoyl peroxide in a prescription form, so it's called benzocaine, and so you get 2-in-1 action.
I think the important thing about combining them, like you mentioned, is patients are always afraid that they're going to become resistant to antibiotics because you're using them every day for months sometimes. And combining it with benzoyl peroxide, I believe it was benzoyl peroxide, and you can correct me, but showed that that's what actually decreased the resistance. So that's a great combination.
You cannot become resistant to benzoyl peroxide, which is awesome because it can work forever and it is still bactericidal, so it's killing your bacteria. And also, on top of antibiotics, sometimes we utilize hormonal kind of blockers called spironolactone. Spironolactone is generally known as a diuretic, but it can also be used to block your male type of hormone from being increased and therefore causing acne. So it's great for a lot of females and can really help with hormonal acne. And then ultimately, if you do have severe acne, I don't hesitate to have a conversation with my patients about accutane. I know there's a lot of Is it safe? What is the deal with Accutane? We can go into that in a whole other video because it's a lot, but just high points would be, it's a vitamin A derivative. It can be ultimately curative, more or less, for acne, and it is the only curative, and I say that in quotes because not every patient may be cured with Accutane, but if you do the right dosage for the right amount of time and you are kind of the ideal candidate and it works for you, you may never have acne again after you undergo Accutane. It's just a really good option because ultimately with severe acne and even sometimes moderate acne and honestly even mild acne, you can have scarring, and sometimes that scarring can be more bothersome to you than the actual acne lesions, because acne can go away. We can treat it in different ways. We have the tools. However, scarring, ultimately, when you do get that, if you get it from whether it's hyperpigmentation or it's an atrophic scar, like an indented scar, that can be devastating because that's generally much harder to treat. So, with my patients, we want to get ahead of it. We want to get acne while it's still, controllable and get it out of the way, because then ultimately you don't get the scarring, which is the aftermath.
Absolutely.
Every derm has kind of their own secret sauce for what they like, and also it depends on each patient. So going back, it's an individual approach. No one treatment can fix all.
Right.
So really it's an evaluation process and understanding what's going on with you, and then going from there.
And I think it's a process. That's a key word there. It's not gonna go away overnight.
Yeah.
It's gonna take, I usually say 2 to 3 months at least to see at least a 50% reduction. And it's a combination of treatments. We just wanted to give sort of a nice overview of the cause of acne and some good treatment options and just sort of start that conversation.
I think that pretty much wraps it up, you guys. If you have any questions, please drop in the comments below and let me know what your thoughts are, and just keep me posted. I'd love to hear from you guys.
Thanks for having me.
Thanks for having us. Take care.
Good. Can I just push the red
Thanks for
button?
having us.
I don't know. Can I push the red button?
Yeah.